So the other day, I talked about what is schizophrenia. And today, I want to talk about what is bipolar disorder. Because just like with schizophrenia, and I've also talked in the past about PTSD and things, a lot of these mental health disorders are very misunderstood. And I truly believe, as someone that was in the mental health profession, that education is vital to understanding what exactly is a mental health disorder and what are all the different types of mental health disorders. Because if you just pick it up out on the streets or from TV, movies, things like that, so oftentimes they're misrepresented and a lot of times confused even with other types of mental health disorders. So let's dive in today and take a look at what exactly is bipolar disorder. So, first off, it is, like I said, a mental health condition. It doesn't mean you're crazy or anything like that. It's just a mental health condition. Mental health conditions, like I've said in the past, are really no different than having a physical health condition. Someone with kidney disease, does that mean that they're crazy? No, of course not. You're not going to think that. Same with other mental health conditions. Just because somebody has something like that, that does not mean that they are crazy, insane, dangerous, or anything like, again, the Hollywood media tries to make it out to be. So if you know somebody that has it, you don't need to be afraid, okay? And what happens with bipolar disorder is that they have very intense levels of energy and activity levels, moods that can range from episodes of mania or hypomania, which is a high, to episodes of depression, which would be, of course, a low. And unfortunately, it is a long term condition, but the good news is that there is treatment for it. And with that treatment and making sure that they take their medication regularly as prescribed by their doctors and stuff, they can live stable and very fulfilling lives just like everyone else. Um, and you might not even necessarily with them on their medication and everything, even detect that they have something like that. So again, don't believe everything you see on TV and in the movies. Bipolar disorder, like I said, it is a chronic mood disorder. And it involves, like I said, periods of mania and hypomania. And I just want to touch on that a little bit for you because the two are different. So with mania, you have periods of unusually elevated or sometimes irritable mood swings. You can have very high levels of energy, or then you may have very low levels of energy. Um, when you're having the high levels of energy, a lot of times you have a very reduced need for sleep. So you could go all night without sleeping, or sometimes a couple of days without sleeping. You may have very racing thoughts constantly going on in your head. You may have impulsive behaviors, or you may have a feeling that you are unusually powerful. Mania can become severe enough to cause a break from reality known as psychosis. Whereas hypomania is a milder form of mania. And that doesn't cause major impairment like mania does, but it is still noticeably different from a person's usual behavior. So, that is the definitions of the manias. And I want to take a look as well at the depression. Of course, most of us are very familiar with depression, of course, but depression with bipolar disorder is a little different. You may have periods of deep sadness, low energy, loss of interest, your sleep may change, you might have difficulty concentrating, or even thoughts of death or harming yourself. You have different types of bipolar disorder, so it's not just cookie color. You have three different types: bipolar 1, bipolar 2, and cyclothymia. Now, bipolar 1 is at least having one full manic episode. And depressive episodes are common but not required for the diagnosis. Whereas with bipolar 2, you have to have at least one hypomanic episode and one major depressive episode. No full manic episodes. The cyclothymia is chronic fluctuating low-grade hypomanic and depressive symptoms for 2 or more years. So they're all very different, like I said, and that's very interesting. There is no single cause for bipolar disorder. It could be genetics, which means it runs in the family. It could be brain chemistry and structure differences, or even stressful life events or trauma can cause it. It's usually treated with mood stabilizing medications, atypical antipsychotics, psychotherapy such as cognitive behavioral therapy, lifestyle structure like sleep routines, stress management, and support systems. Many people do need long-term treatment because the symptoms can return without it. That's why I was saying that it's very important to stay on your treatment plan, because with it, you will thrive. Without it, you're not going to thrive. And we all deserve to thrive in life, don't we? Why does it matter? Well, understanding bipolar disorder matters because it can affect relationships. It can affect your finances, overall functioning if untreated. It also carries an increased risk of harming yourself, especially during depressive or mixed episodes. But, like I said, if you stay on your treatment, that's the good news. That with progressive research and everything that's gone into understanding a lot of mental health disorders, there is nowadays really good treatment and everything out there that didn't used to be. So, if you know someone with bipolar disorder, now you can understand more. Or if you don't, this way, if you ever do, you're gonna know that you don't need to be afraid. You don't need to have any misconceived perceptions that are out there about mental health disorders. And if you are someone that has bipolar disorder, you are awesome. You're amazing. And stay on that treatment. And if you're not, please get on treatment plan. See your doctor, because you deserve to have your best life and to thrive, not just survive. And I will see you next time. Take care and have a wonderful day. I love you, but more importantly, Jesus loves you. I'll see you next time. Bye-bye.